where we make a compilation on critical health issues designed to reach all segments of the society and provide solutions through the instrumentality of medical professionals. And today we have with us Dr. Charles Chukwu. Good afternoon, Dr. Charles.
Good afternoon.
It's good to have you here.
My pleasure.
Yes, Dr. Charles is an OB gynecologist specialist. So trust me, it's amazing that we're able to get you to sit here. Welcome again.
Thank you.
So today we want to talk about ectopic pregnancy. So of course I want to start with, what is ectopic pregnancy?
Ectopic pregnancy is an abnormal kind of pregnancy.
Okay.
Abnormal, not in the formation of the embryo, but abnormal at the site of implantation of the fertilized oocyte or egg.
Okay.
During the menstrual cycle, a woman ovulates after the menstrual flow.
Okay.
If during ovulation the woman has an intercourse with her spouse, the sperm swims up through the vagina into the cervix, then into the uterine cavity, which is commonly known as the womb.
Okay.
And from there, it swims into the fallopian tube.
Okay.
And while in the fallopian tube, the ovulated egg awaits the sperm for fertilization. The sperm fertilizes the egg, and in a normal setting, the fertilized egg moves into the uterine cavity, into the womb, where it gets implanted, and pregnancy begins to grow from there. But in ectopic pregnancy, there's an aberration.
Okay.
In that, after fertilization of that egg, the fertilized egg gets implanted in the fallopian tube. In most of the cases. This implantation can also occur in other sites, like in the ovary. For example, if there's a delayed ovulation and the sperm is able to migrate up to the level of the ovary and fertilizes an egg released at that point, fertilization can occur at the ovary. Okay. Then fertilization can also occur in implantation can also occur in the cervix. If during migration to the womb, that's the cavity of the uterus, and it continues and did not stop, gets to the cervix, it can get implanted at the cervix. But the commonest site of this fertilization is in the fallopian tube in about 97% of the cases. So that is what ectopic pregnancy is, when a fertilized egg is implanted outside the uterine cavity. That's what ectopic pregnancy is all about. So it can be implanted in the fallopian tube, it can be implanted in the ovary, it can be implanted in the cervix. Yes. Even in the abdominal cavity, you can have an ectopic pregnancy. So what are the symptoms of this ectopic pregnancy? How do you tell that one has ectopic pregnancy? Well, first thing is that the woman will miss her period. Okay. Which is common with pregnancy. Okay. Okay, once pregnancy occurs, your next period will not be seen. Okay. So the woman first identifies that she is pregnant. Okay. Okay. Now, because, like I said, the commonest site is the fallopian tube. Because the fallopian tube is a very thin structure, it does not have the capacity, the strength to sustain growing pregnancy. Okay, so while the pregnancy is growing, it begins to stretch, and after a while, it can give way. All right? So, one, the woman will notice that she has missed her period. Okay. Two, while the pregnancy is growing, she will present with symptoms of abdominal pain.
Okay.
Because one of the causes of pain is the tube begins to stretch. It gets to a point the tube can now give way. So at that point, the pain increases. When the tube gives way, the woman starts bleeding into the abdomen. So the bleeding into the abdomen is also one of the causes of pain, what we call peritonitis. It begins to irritate the peritoneal cavity.
Okay.
Yes, the blood begins to irritate the peritoneal cavity, and the woman presents with severe abdominal pain. Then another major symptom is features of anemia. Anemia is shortage of blood.
Okay.
Remember I said she will start bleeding into the
yes.
Cavity, into the peritoneal cavity. Now, some women bleed as much as 3 liters, 4 liters into the peritoneal cavity. So
within what duration, please?
Well, sometimes it begins gradually. The bleeding may just, be gradual.
Okay.
Depending on the size. Okay, depending on the size of the ectopic.
Okay.
Okay, because along the fallopian tube, you have different parts of the fallopian tube. The commonest part where this ectopic pregnancy occurs in the fallopian tube is called the ampulla.
Okay.
Okay. At that point, that is the waiting point of the ovulated egg.
Okay.
Where the sperm meets and fertilizes. Implantation occurs there.
Okay.
Then when the tube gives way, bleeding, starts occurring. So this is usually identified within 6 weeks to 8 weeks
okay.
of gestation. So if it ruptures and the woman has bled so much, she may present with features of anemia, which may include dizziness, excessive tiredness, and sometimes fainting. In fact, most times what usually brings them to the hospital is sudden collapse. They will now rush the person to the hospital as an emergency.
So within 6 to 8 weeks, that's when this person begins to present with all the signs of ectopic pregnancy.
Yes.
So before this period, we can't really tell.
Before this period, you cannot really tell
there is ectopic.
There is ectopic, except if the person is very health conscious and does an early scan,
Okay.
The scan now finds out that the uterine cavity is empty. That there is a gestational sac outside the uterine cavity. In that case, the diagnosis is established even before the patient starts feeling the symptom.
So in that case, what can be done? Removal?
Yes, ectopic pregnancy is an abnormal pregnancy. So there are different ways you manage it.
Okay.
There are different ways of management.
Okay, we'll get to that.
Sure.
But then I want to know, what are the causes and risk factors of ectopic pregnancy?
Okay. The risk factors of ectopic pregnancy may include, first, let me describe something that will make the viewers understand how it happens.
Okay.
The fallopian tube has a very smooth surface.
Okay.
Very smooth surface. Now, the smoothness of the surface and some projections of a structure or structures we call cilia ensures the movement of the fertilized egg to the uterine cavity after fertilization.
Okay.
Now, if that surface is distorted by whatsoever factor, then we can have ectopic pregnancy. Now, what are the things that can cause that? Pelvic inflammatory disease, okay, which is mainly sexually transmitted.
Okay.
Now, it is an ascending infection which gets to the tube and causes scarring of that smooth surface. So when that surface scars, the fertilized egg will not be able to migrate smoothly to the cavity where it should be implanted. Okay, movement is not altered, it's not getting implanted at that point. So the infection can cause that. Okay, risk factor for that may include multiple sexual partner.
Okay.
Or the woman may not have multiple sexual partner, but her spouse may have multiple sexual partner. So indirectly, you're having a multiple sexual partner, and that will also lead to sexually transmitted infections, which can cause the scarring. Okay. That's one. Then two, cigarette smoking also affects the cilia I mentioned earlier. Okay. Okay, and that affects the movement of the fertilized egg. Then also, some people who use contraception, okay, contraceptive method. Now, when you use contraception to prevent as a family planning method, there is less tendency of having pregnancy. Okay. Right? However, if it fails, if the method fails, especially the progesterone-only methods, such as implants, then progestogen pills, the hormone reduces movement along that fallopian tube. So that can also affect the movement of the fertilized egg and also causes implantation at that point. Okay? Then some procedures within the fallopian tube, okay, can also cause it. Maybe a surgical procedure previously along the fallopian tube can also cause ectopic
What kind of
pregnancy.
procedures, like abortions or something?
No. Abortion does not occur in the fallopian tube.
Okay.
Abortion is for a normally situated
removal
pregnancy.
of a normal situated pregnancy. Okay. So it doesn't affect the fallopian tube.
Yeah, it doesn't affect the fallopian tube.
Okay. So right here we have sexually transmitted diseases or infections which can cause the inflation of the pelvic.
Yes, pelvic inflammatory disease, PID.
Okay, and then we have
cigarette smoking. Okay.
And then we have failed family planning procedure.
Yes, contraception. Yeah.
Okay. So now I want to ask, but before then, a question popped to my mind while you were talking. Is there any success rates of ectopic pregnancy? Is it possible to carry the baby to term if you're able to deal with the pain, you know? Is it possible? And then you also said it can be detected early if the person is health conscious, and then the moment you discover you're pregnant, you go to the hospital for scan, and then discover that the pregnancy is not in the right place. Is it also possible, having discovered it early, to move the pregnancy, to probably move the, what's it called, the fetus? Yeah, that time is it fetus or embryo?
I understand your question perfectly.
To move it to the uterine cavity.
No, this other one now is not possible. But there is a possibility in having a live baby in ectopic pregnancy. Okay? I have seen, an abdominal pregnancy. Okay. In the abdomen.
Okay, not the fallopian tube.
Not in the fallopian tube. The fallopian tube is a thin structure.
So it can't carry?
No, it cannot.
Okay.
Do you understand? Yes. It cannot. So, outside the uterus, the other place that I've been able to have a successful live pregnancy is the abdomen. So, fertilization can also occur in the abdomen. So, you can have a live baby.
In the abdomen.
You can have a live baby, which I have seen, carried to term, and the operation is carried out, and a live baby is brought out from the abdomen. Okay, so that is one scenario where you can have a live baby from ectopic pregnancy.
So that kind of...
So outside that, you cannot have a live baby from ectopic because the other structures cannot sustain pregnancy.
So that kind of pregnancy in the abdomen, is that a high-risk pregnancy or is easy to manage?
It's a very high-risk pregnancy. You should know that because it has left its normal place and it's growing elsewhere where it's not supposed to. Is a very high-risk pregnancy because you have the placenta attached to structures like the liver, the intestine, and other structures around. In fact, after delivery of such baby, you don't even try to deliver the placenta.
So what do you do? You
leave the placenta there, and it's taken care of with some medication.
Oh.
Because if you try to, you cause so much bleeding from, those other structures the placenta is attached to, and the woman will not make it.
So medically, the first advice would be to remove if it's pregnancy in the abdomen.
If the pregnancy is growing well in the abdomen.
Okay.
So, as a specialist, you know it's a high-risk pregnancy, then you manage it as such. Okay. You have a high index of suspicion for any emergency, then you handle it appropriately.
Okay.
But at other sites, you cite an ectopic in the fallopian tube, or ectopic in the ovary, or ectopic in the cervix. Of course, those are the areas where you can consider removing. Okay.
So what are the treatment options for ectopic pregnancy?
Okay, treatment options may include expectant management. In expectant management, you don't really, you're not aggressive. Okay. May include medical, that's use of drug, and it could also be surgical. Okay. In expectant management, there are criteria that must be met. Okay. There are some hormones that you'll be monitoring. For example, there's something we call beta HCG, human chorionic gonadotropin. Okay, you monitor the quantity. Okay. Now, if that ectopic meets the criteria, all right, you will now monitor the quantity of that hormone, okay, that is being released by the pregnancy. If it's declining, all right, so in that case, you may institute an expectant management. Medical management, there are also criteria too. The ectopic, the woman must meet, okay, before you can also institute a medical management, that's use of drug, okay. But in most of the cases, it's surgical. Okay,
so medical management is the use of drug?
Yes.
We have surgical. Which one is expectant management?
In expectant management, you don't do anything, you don't give anything.
You just...
You keep monitoring the woman closely. Okay. You keep monitoring the level of the human chorionic gonadotropin. Okay. For example, an ectopic is sited in the fallopian tube. Okay. The sac, the gestational sac. The gestational sac is the first thing you see when a baby is, okay, when baby is being formed, okay? Okay. That is the casing where surrounding the actual structure that develops into the full baby. Okay. That's the gestational sac. Okay. So the gestational sac must be a particular dimension. That's one. The woman must not have any symptom whatsoever. Like I mentioned earlier, no abdominal pain, no signs that she has a shortage of blood. Then the structure inside that sac will not have any heartbeat. Okay? So if the woman meets all these criteria, okay, then you are now taking note of the beta HCG, and there is a steady decline in the value of the beta HCG. Okay? It means that this pregnancy is actually failed. It's a failed pregnancy. So you can actually not do anything and it will fail and it will be taken care of. But in medical, you don't watch and wait.
Okay.
You use medication.
Medications. Okay.
To get rid of it.
Okay.
There's an injection you use to get rid of it.
Okay.
And there are also some criteria that must be met before
can be medical.
Yes, the drug can be administered.
Okay.
Okay. Then surgical.
Surgical.
Most times, the treatment most women receive is usually the surgical treatment, because they usually present in emergency. They usually present with symptoms, and once you present with symptoms, the treatment approach must be a surgical approach.
Okay. So can this ectopic pregnancy affect fertility?
Yes, it can.
How so?
It can, in the sense that when a woman has an ectopic pregnancy and surgery is performed, it means that particular tube is completely damaged. That tube is gone. Okay, she's now left with another tube. And after an ectopic pregnancy, there's increased risk, okay, of having another ectopic. So if both tubes are damaged, fertility is affected in a way through natural conception. However, a woman can still conceive in as much as the womb is intact. You have the artificial reproductive techniques now, so you can have your IVF done, and then she will conceive. But through natural conception, if both tubes are damaged, in that way it has affected fertility.